Dr. Deepti Pai from Apollo, Ahmedabad. I am consultant pediatric surgeon. Today I will be talking about vesicoureteric reflux. It's one of the most common cause of urinary tract infection in children under age of 5 years. So what is vesicoureteric reflux? Vesicoureteric reflux basically means backflow of urine from the bladder through the ureter towards the kidney. So when the urine forms in the kidney, it usually comes down via a tube called ureter into the urinary bladder, and from there it exits via urethra. So it's like a one-way street, but due to any cause, if there is an obstruction or a primary cause, the urine may go back from the urinary bladder into the ureter and sometimes up till the kidney as well. This is what we call as vesicoureteric reflux or a VUR. So what are the signs and symptoms of VUR? VUR is a congenital disease. That means it's present since birth. So children may present to us as early as 6 months of age or even before that. They usually present with a history of recurrent urinary tract infection, straining while passing urine, difficulty in passing urine, or leakage of urine in undergarments, or even increased frequency of passing urine. How is VUR diagnosed? So whenever a parent brings a child to the pediatric surgeon with a history of recurrent urinary tract infections, we get urine cultures and ultrasound done. So the ultrasound scan tells us the degree of severity of swelling in the kidney and the ureters. Next, we do micturating cystourethrogram or MCU test. It consists of installing contrast in the urinary bladder using a urethral catheter and then asking the child to pass urine. While the child passes urine, we take multiple X-rays and we can visualize the contrast going back in the ureter and up to the kidney in some cases. So we can grade vesicoureteric reflux from grade 1 to grade 5 using micturating cystourethrogram. A DMSA test or a radionuclide scan is what we do next. That is done to see how much the VUR has affected the kidney and whether it has caused any scarring in the kidney. What happens when VUR is not treated? So, treatment of VUR is absolutely necessary and it should never be ignored. I say it with so much emphasis because if you ignore a vesicoureteric reflux, then it may lead to permanent and irreversible kidney damage, which might lead to a kidney failure. What is the treatment for vesicoureteric reflux? VUR has more than one treatment option. Firstly, when a child with a high-grade VUR comes to us, we start them on antibiotic prophylaxis or a uroprophylaxis. It means we start them on a minimum dose of oral antibiotics. Many children with VUR do not require surgery as this disease may resolve with age. They only require a regular follow-up to see the resolution or the progression of the disease. Few children do require surgery. These are the children who develop scarring in their kidneys or deterioration of function, or they develop recurrent urinary tract infection despite being on antibiotic treatment. So for surgery, we can either opt for an endoscopic treatment. This means we inject a medicine inside the bladder at the opening of the ureter so that it narrows down the opening and hence resolves the vesicoureteric reflux. Or we can opt for ureteric reimplantation. This means we position the ureter in a more appropriate place so that the vesicoureteric reflux is resolved. This treatment can be achieved via minimal invasive method or by an open approach. What are the complications associated with the surgery? Although rare, but there might be few complications associated with surgery for vesicoureteric reflux, such as recurrence of symptoms, obstruction of ureter, leakage of urine from the bladder, or need for prolonged antibiotic treatment. Despite these complications, there are ways to manage them, and this is a relatively safe procedure. If you know anyone who is suffering with vesicoureteric reflux, please urge their parents to see their pediatric surgeon as soon as possible. Timely treatment can avoid the complication of kidney failure in these children. Thank you.